Welcome to the fourth module in the Access Pain Management educational series. In this module, we will teach you effective strategies to help manage your pain and to improve your functional capacity. We call these management tools. There are a variety of tools that will assist you to manage your pain, but what works well for you may not be as good for someone else. So we need to offer you a variety of tools so that you can use whichever tool is best for you in a particular situation. What we'll be discussing are education and understanding, physical rehabilitation, challenging your thoughts, problem solving, and cognitive strategies such as relaxation and imagery. As we have discussed already, we know that educating people so they understand why they have pain can lead to improvement in physical capacity, reduction in the threat value of the sensation and then less anticipation of pain, reduction of muscle tension, less fear and anxiety about pain. This then results in increased confidence that recovery is possible. As you have learned, these changes can be seen on specialised brain scans called functional MRI scans. As understanding improves, it has been found that areas of the brain that were previously active in interpreting and creating pain become less active, which corresponds to reduced perception of pain. The type of education that leads to these improvements is specific learning about how the nervous system and brain creates and maintains pain, and how fears and anxieties can actually make pain worse. This is what we have discussed throughout the modules of this education series. Some of these concepts are quite complex and difficult to understand initially. The better you understand what is happening in your body, the more confident you will be in participating in rehabilitation. Once you understand these processes, you can begin to manage your pain more successfully through other tools that we will discuss now. Matt, we have discussed that the amount of pain someone experiences is not always directly related to the severity of the injury, and along the same lines, we also know that in chronic conditions, pain does not necessarily mean that they are causing further damage to their tissues. Could you please explain this?
Well, current knowledge in pain management has shown that the severity of pain doesn't always match up with the severity of injury. In chronic pain, there are a number of other factors that can increase and maintain your pain. Recall that we talked about this in Module 2. The nervous system actually changes in chronic pain in a process called sensitization. There are more receptors around the site of the initial injury, so changes can be detected earlier than normal, and chemical changes occur in the nerves, especially at the nerve connection sites called synapses, and this makes nerve impulses more likely to reach the brain. Your natural painkillers, like your endorphins, they actually switch off, and also the brain becomes a bit more active in interpreting and producing pain.
So how does this sensitisation process affect how we should approach rehabilitation of chronic pain?
So what sensitisation means is that pain can be experienced before there's any actual injury or damage at the injury site. The sensitised nervous system is acting to overprotect the initial injury. So we say that hurt doesn't equal harm. Sensitisation can produce pain or hurt before any injury or harm develops. We say that due to sensitisation, you can be sore but safe. This means that despite some pain, you can safely perform a level of exercise, even if you're experiencing some degree of pain. The trick is to work out how much exercise you should do.
The second management tool in chronic pain management is physical exercise. So David, how can someone with chronic pain return to activity or exercise safely?
Well, Rosemary, chronic pain results in stiffness and weakness not only to your injury but to the rest of your body. This is because you've reduced your normal level of activity. Physical rehabilitation involves reversing this process and resuming exercise and activity to both strengthen the body part as well as your general exercise to recondition your body and get it back into shape. The difficult part is that because your nervous system is sensitised and too protective, you have pain at low levels of exercise, and this makes it difficult to exercise. This is when you have to remember all you know about the nervous system and that hurt does not equal harm. We use a process called pacing and graded exposure to overcome this sensitivity to movement and exercise. It's a safe method to start exercising, so you'll not cause any harm to your injury. Pacing and graded exposure simply means slowly building up your movement, activity and exercise tolerance. Building up your activity and exercise slowly allows your sensitive nervous system to improve its tolerance to movement. Desensitising the nervous system involves gradually exposing your injured tissues along with the rest of your body to more and more movement over time. As your body gradually increases activity, the nerves will gradually become accustomed to the movement and the sensitivity in turn will reduce. Also, as you understand that the movement is not harmful, the fear and anxiety associated with the movement will also reduce.
So, if someone, for example, needs to improve their walking tolerance, how do they go about improving this?
Walking is a good example. However, keep in mind that there are other exercises or activities that you need to do in conjunction with a walking program. But if we do look at walking in isolation, it's important to find a baseline or starting point. This means finding out the amount of walking that you can tolerate without causing too much pain or discomfort. It might be only 5 minutes, or it could be as long as 20 minutes. Once you have this baseline and have worked out your goals, that is, what you want to achieve, such as walking for 30 minutes to do the shopping, the challenge is how to go from your baseline level of activity up to your goal. The principles of pacing are slow, gradual increases in activity, progressive increase in time exercising despite some pain. For example, start walking 5 minutes, then 7 minutes, and so on. Increased number of repetitions of an exercise you perform. Using a heavier weight with a certain exercise. Changing the location of your exercise. For example, starting at the physiotherapist's clinic, progressing to exercising at home, progressing further to a gym, and finally to exercising after coming home from work. Have a structured plan for how you will pace your exercise and activity program. Stick to this plan even if sometimes you experience some pain while doing the exercise. Remember that your nerves are sensitised and they're trying to overprotect you. Remember that you are sore, but you are safe. Keep an exercise diary. You can record your daily progressions so that you can see your improvement in physical capability. This can also help you remember how far you have progressed towards your goal.
Here we have another question. Pacing means finding an exercise or activity that I can manage and slowly building up that exercise or activity. True or false? The answer is true. It means a gradual progression of your exercise or activity. Nathan, we learnt in Module 3 that thoughts and beliefs can have a powerful influence on pain perception. If thoughts can help us or hinder us, how can we adjust our thoughts to make them work for us?
The key to this is awareness of our thoughts. We can only hope to change our thoughts if we're able to identify them as unhelpful and then look to challenge them, to make way for more adaptive thoughts and behaviours. Here's an example. John believes that his back pain is too severe to do exercise. If he maintains this thought, he's unlikely to improve the function of his back. If he can challenge this rigid thought to the notion that exercise and movement can be helpful, even if it creates some discomfort, he can begin to work towards improving function. His thoughts are vital to whether he will get back to better function.
So how do we change the types of thoughts which are unhelpful?
That can be challenging. In John's case, he needs to increase the awareness of negative automatic thoughts, or NATs for short, especially around situations involving movement. I'd encourage John to keep track of situations that involve strong negative emotions, especially associated with movement. I'd use a form similar to this one to help monitor and change these thoughts. Take a look at the form now and try to answer some of the questions for yourself.
The form is helpful in developing your awareness of thoughts, feelings and behaviours. In the first column, the situation, you've had a stressful day at work and your partner makes a comment as you walk in the door. What's for dinner? Your feelings around this can either be positive or negative, and in this case you feel angry and upset. Your behavioural response to your partner, in this case, you yell back at your partner. The next column is your thoughts, and one of the key questions to ask yourself here is, what thoughts or images went through your mind immediately before this situation? In the last column, the alternative thought, we need to generate another more helpful way of thinking about the situation. In this example, it may go something like, I'm sure I mean more than that. I'm taking 15 minutes to relax before I do anything else.
So we've heard how stress and pain are related. Nathan, what are some of the ways in which we can manage pain-related stress better?
Some well-known techniques act directly on our physical responses to pain. Skills such as progressive muscular relaxation and abdominal breathing are very helpful in reversing our body's flight or fight response. You might use these at times when you've responded emotionally to your pain or when you're feeling overwhelmed. This might be in situations when you're preparing for sleep or after you've had a particularly difficult day. Mindfulness-based approaches involve meditative type practices which change the way we interact with our feelings and thoughts. This is helpful when many of our thoughts and feelings around pain are negative. Mindfulness can change the way we respond when in pain, reduce our stress and increase self-awareness. They do, however, require regular practice, like many skills. Imagery is using the power of our mind to create possibilities and is another powerful technique. For instance, if you're currently moving with a limb, it may be useful to imagine moving in a normal or pain-free way. This can actually send nerve impulses to the muscles involved and help to improve the way you're moving. It's practice without movement, if you like, which is great if movement involves significant pain. The advantage is that your mind can take you anywhere and imagine anything that you want to achieve or do. None of these techniques can take pain away, but they can assist in reducing your suffering. This is an example of a stress management technique. Matt, I'm going to take you through a mindfulness-based activity. So just follow my instructions. Just get comfortable. Do you feel comfortable there?
Yes.
Okay. And just allow your eyes to close. And what I want you to do is just to focus on your breathing. And just notice as much as you can about your breathing. The rate, the depth of your breath. Notice what parts of your body are moving when you breathe. Another relaxation technique is abdominal breathing. Matt, this morning I'm going to take you through a relaxation technique called abdominal breathing. So what I'd like you to do is just to get nice and comfortable, allow your eyes to close, and I'm going to ask you to use your imagination a little bit. I'd like you to imagine there's a red balloon in your stomach, and as you breathe in, that balloon expands, and as you breathe out, the balloon flattens. And what you might notice as you're doing that, it's in fact what your stomach does. So just try that a couple of times. Stomach up as you breathe in.
We know that managing chronic pain is not always a smooth road, and we can expect some ups and downs. Most people have occasional flare-ups during rehabilitation. There needs to be a plan in place for management of flare-ups. This plan should be made early in the rehabilitation process so it can be called upon when it happens. The main tips for managing flare-ups are: don't panic. Remember your knowledge about the nervous system. The sensitised overprotective system can produce pain before there is any damage to the initial injury. Remember, hurt does not equal harm, and you are sore but safe. Rethink the progression that you made that caused the flare-up. You may have progressed too fast. If so, return to the baseline level of exercise and try to progress a little slower. Use cognitive strategies and stress management techniques to help you cope with the pain, such as abdominal breathing, mindfulness, and imagery. Challenge your thoughts and beliefs about the causes of pain. Stay positive and remember your overall goal.
We hope that working through these modules has given you insight and strategies to help you manage your pain. So be brave, give it a go, and good luck.